Oh, hello. We're here today looking at EnerPeel and the application of EnerPeel. In this particular episode, we're looking at EnerPeel revised Jessner's. That's Jessner's is a combination of salicylic acid, lactic acid, and resorcinol. And both the lactic acid and the resorcinol are particularly good at working on pigmentation, whether it's age-related, hormonally related, or sun damage related. The client is prepared, so hair is out of the way of the area we're going to treat, the eyes are protected, the lips have Vaseline on, and there will be Vaseline on any things like raised moles or any areas of concern, and the rest of the client is covered up as well. So the only area exposed is the area we're going to treat. Now we're about to use the prep wipe. So the client has already removed makeup, and these prep wipes are designed to remove surface lipids from the skin. They are quite powerful. You should always use gloves when you're doing a peel, but if you didn't, these would take nail varnish off, so be aware. And the client needs to be aware as well. Now the client will obviously have the peel on the skin for up to 5 minutes or until the first sign of a frost. Normally it goes for 5 minutes because by that stage the salicylic acid component of the Jessner's has converted to a salicylate, which is like a powder on the skin, and that is neutral. The main aim is to leave the lactic acid and the resorcinol active in the skin to work on the pigmentation. So you can see now, if I can just zoom across here, you can see the Jessner's vial, which is 2 ml of the solution. Half of that solution is EnerPeel carrier. Each carrier molecule is bonded to one of the acid molecules. So the 2 ml is, you really want to get as much of the 2 ml on as possible. You can see there's a brush applicator. Our aim is not to cause surface erythema by rubbing the skin, so we're going to use the brush to lightly apply it. Now our clinician is just getting the fluid flowing. The idea is to keep that, and I'm watching the timer now, so it's just started 2 minutes 18 in. I want to make sure, nice slow, drawing it out, get a nice good damp look, but it's not running. You can ask the client to turn the head slightly to the side, that can help. Try and keep the brush as vertical as possible, and just as you brush you might squeeze a little with the thumb and finger because that can get the flow going, but it should just flow out on its own. And we're going on for now, we're nearly coming around to a minute in, so it's a good time to ask the client, can you feel anything?
Not yet.
Not yet. So when you do feel anything, on a scale of 1 to 10, where 10 feels like you've had your leg chopped off, and 1 is about as annoying as my voice, so we'll keep checking with you. So we're just coming around to the minute now. Can you feel anything? Or a number, 1 to 10?
It's starting to tingle a little bit.
Just tingling now. That's a good sign. If somebody really started giving you high scores within the first minute, then you should maybe consider whether they may have an allergy to one of the ingredients. Now just going round, get a good layer on. I think you're just topping up the layer. You can put multiple layers on with the Jessner's. It's quite often a second layer. People can go up to 6 layers of Jessner's, but the idea is that we want the salicylic acid to reduce oil in the surface, and we want the lactic acid and the resorcinol to go into the skin to work on the melanocytes to slow down pigment production. The lactic acid also helps with the exfoliation, so any pigment that's already in the keratinocytes can help come to the surface and be removed quicker. So this peel will stay on now for the next 3 minutes. We're 2 minutes in, or 5 minutes. So I'm just going to stop it now. I don't know whether you can see any powder forming. Just here on the cheek you can see the salicylate starting to form. What pain score are we on now? On discomfort score 1 to 10?
2 or 3.
2 or 3. See, the Jessner's is quite, because resorcinol isn't that strong an acid, and the lactic acid is only at around 15-16%, and the salicylic acid is only around 15-16% as well. It does vary with different Jessner's, but you'll find that the actual discomfort is usually marginal. You see the erythema, the reddening, and Helen is quite prone to erythema, and it's very minimal at the moment. And again, I stress that the key ingredients in the EnerPeel are being taken into the skin before they're activated, so surface erythema is a lot less. So we're just coming around to the end of the 3rd minute, so I'm just going to pause it here and then we'll come back for the remover phase. So here we are back again with the EnerPeel Jessner's application. We're now at the neutralization stage. So the peel has been on the client for 5 minutes. There is some salicylate forming, but the aim now is to use a EnerPeel remover wipe, which is just to remove anything left on the surface, which will be some salicylic acid that's converted to a salicylate powder, which actually has an analgesic effect, and some remnants of the EnerPeel carrier solution. We're using a remover wipe, not an EnerPeel neutralizer wipe, because we want to leave the key depigmenting agents in the skin working on the pigment. One of the big mistakes people make with Jessner's is they neutralize it. Now we get a better result with our Jessner's than maybe with others because the EnerPeel solution, the EnerPeel carrier solution, carries the resorcinol and the lactic acid into the skin to have a bigger impact on the melanocytes. These peels are normally done 2 weeks apart, and in between the peels, and for up to a month before the peel, you would often use a Tebby-Skin or lightening creams. We have a Tebby-Skin lightening cream as well as a UV version, but these should be used to help support the effect of the Jessner's. The lightening creams also contain resorcinol, which is one of the ingredients within the Jessner's peel, so it's almost like a continuation of the treatment. Now this peel was developed by a gentleman called Jessner's, who created a cocktail all-round peel, but the salicylic is really there for oil and the other two are there mainly for pigmentation. Lactic acid can give an exfoliation. We find the Jessner's peel is the ideal peel for actinic keratosis, hormonal pigmentation, solar lentigo, sun damage, etc. And on a scale of 1 to 10, now that everything's been removed, how does it feel, Helen?
It's probably still about a 3, but it's...
Still about a 3,
yeah.
So just make sure that it's all gone down. There can be this tingle as the solutions are just removed. The only reason you would neutralise the Jessner's is if the client was experiencing excessive discomfort during the first 5 minutes. Even then I'd probably use the remover, use some damp cotton wool pads to then go over the skin to remove any of the remaining carrier, and then apply the UV. And even then I'd only use the neutraliser if the client was still saying they were in discomfort. As I've just said, now our clinician is going to use 2 damp cotton pads with water on. You can use cold water or lukewarm water, it's your choice. This is removing anything left post the remover because there can be some sticky residue, but we are leaving the active ingredients in the skin but not on the skin. So the client's skin will feel very soft and smooth now, and we'll also apply some post-care cream which is anti-reddening and also calming and protecting so that the client can go about their daily routine. Any flaking or peeling, if it does happen, in this case I would think it would be minimal, would be sort of 2 to 3 days, maybe 4 days later, and using the post-care creams I don't think anybody noticed apart from maybe the client. So there we have an EnerPeel Jessner's, known as an EnerPeel JR. Thank you.